If the thought, I guess this is good as it's going to get, starts showing up, it may help to ask whether the specific ability you want has actually been trained. That distinction can point to a next step without assuming that every symptom can or should be fixed through more exercise. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. If you're somewhere between 4 months and a year after your knee replacement, this episode is for you. By the end, you'll have a clearer picture of what can still change during this stage, what may still need your attention, and why being past the operation doesn't tell you whether you've reached the strength and activity level you want. The first few months after surgery usually have a clear purpose. You're working through swelling, regaining motion, rebuilding enough strength for daily activities, and becoming more independent. Appointments, exercises, and visible milestones give the process structure. Then that structure begins to fade. You may finish physical therapy, see your surgeon less often, and notice that people have stopped asking you how your knee is doing. Life starts looking more familiar again. That return to a more familiar routine is welcome, but it can leave you unsure of what comes next. You may be driving, shopping, working, and moving around your home without thinking about every step, while stairs still take more effort than you expected. Your operated leg may tire sooner than your other leg, and longer walks may still feel awkward. From the outside, you may appear to be doing very well, while a few important activities still feel unfinished. As daily life becomes more normal, the question becomes less about getting through surgery and more about what you'd still like your operated leg to help you do. For one person, basic errands may be enough. Someone else may want to work a full shift, walk through an airport, handle stairs more easily, return to the garden, or get back on the golf course. There's no single goal that fits everyone. Total knee surgery can reduce arthritis pain and create the conditions for better function, but it doesn't automatically rebuild strength, balance, or endurance. You now have an opportunity to continue building strength, function, and capacity around your new joint over the next several months. After preparing for surgery and working through the demanding early weeks, it's easy to ease off just as the next phase begins. The work you've already done still counts, and the next phase can focus on the activities you want your leg to handle after your total knee surgery. Instead of thinking, am I finished? A more useful question may be, what do I still want my leg to be able to do? The answer may involve walking farther, managing stairs with less effort, returning to work, travel, or getting back to an activity that you enjoy. Once you identify a specific activity, your strengthening and activity program has a reason to keep evolving. And this is often the point when the challenge begins to drop. You may finish physical therapy and become less consistent with the exercises because walking around the house feels fairly easy. Ordinary daily activity may be enough for the life you want, but when the activities you value require more strength, endurance, balance, or control on uneven ground, those abilities may still need focused work. Time allows your knee and symptoms to continue changing, but time alone does not progressively strengthen your quadriceps. Strength develops when your muscles are asked to handle an appropriate challenge, while endurance builds as activity increases in manageable steps. Balance can also improve through practice that's appropriate for your current ability and safety needs. Your program also does not need to stay frozen at the exercises you were given during the first 6 weeks. Early on, getting your knee moving, standing safely, and walking through the house may be major accomplishments. During months 4 through 12, exercise choices are often more useful when they address whatever still limits the activities you want to do. Strength may still be limiting you if stairs or rising from a lower chair take considerable effort, or if your other leg continues to do more of the work during a sit-to-stand movement or stepping up the stairs. You may walk a reasonable distance and still feel weak when your operated leg has to control more of your body weight, because level walking and higher demand tasks do not require the same amount of strength. Walking can look fairly good before strength fully catches up. On level ground, your body can use rhythm, momentum, shorter steps, and compensation strategies to keep you moving. But stairs, curbs, low chairs, and controlled lowering ask more from your quadriceps. Going downstairs can be especially revealing because your quadriceps must control your body weight while your knee bends. That's why you may walk through the grocery store fairly well and still feel shaky stepping down from a curb after a long bout at the store. That difference can simply mean you've not built the next layer of strength yet. Endurance may be a bigger limitation for someone else. Your knee can feel reasonably good for the first 20 or 30 minutes on your feet, but then your whole leg becomes tired and your steps shorten. In that situation, focusing only on knee motion or repetitions in one exercise may miss the larger problem. A gradual plan for longer periods on your feet or farther walking may be more relevant, provided the increase does not cause a large or lasting rise in symptoms. Balance or uncertainty may be the main issue instead. You can cross your living room without thinking about it, yet grass, gravel, crowded places, and quick changes of direction still make you feel cautious. For pickleball, hiking, dancing, or walking heavy vacations, you may need gradual practice with the specific conditions that still feel difficult. Use appropriate support or professional guidance, for example, a physical therapist, when needed. A date on the calendar is not a functional finish line. 4 months does not automatically mean you should be able to do everything. 6 months does not automatically mean improvement is over. And 1 year does not automatically tell you how strong, active, or capable you can become. The calendar tells you how much time has passed. It cannot measure how much capacity you've built or what may still be possible with appropriate work. This is really an opportunity to go the distance and to get even stronger so you can get back to doing the things you want to do. Research shows that people follow different paths after total knee replacement. What someone reports about their function also does not always match how they perform on walking tests, stair or chair tests. And higher demand activities may continue to expose weakness, endurance limits, or movement strategies after basic walking has improved. And that's okay. That variation is another reason your month 6 cannot be judged by someone else's month 6. The point is not that everyone should keep pushing harder. It's that your activity has to give your body a reason to adapt if you want it to progress. If your routine stays exactly the same every day, your body becomes more efficient at that routine. And that's great. It has no reason to build significantly more strength or endurance than the routine requires. And you don't need dramatic workouts or hours in the gym. The challenge simply needs to match the activity you want. Easier stairs may require more leg strength and step control, while an hour of walking on vacation calls for gradually increasing walking tolerance. Returning to golf, gardening, hiking, pickleball, or a physically demanding job may require practice that begins to resemble the actual demands of that activity. I commonly talk to people about when they're returning to work that they progressively increase their activities at home before that first day begins. And I've had people report back to me that that really made a difference for them. The key word, though, is gradually. More is not automatically better, and one exhausting day is not the same as progressive training. The human body usually responds better to repeated, manageable challenges than to random bursts that leave you significantly more swollen, sore, or tired for several days. And useful work is work you can repeat. A few well-chosen exercises performed regularly may do more for you than a long list that is rarely completed. And a walking program that increases intolerable steps is generally more useful than repeatedly testing the farthest distance you can manage. The examples that follow are general education, not a personal exercise prescription, and I'm not your physical therapist. A podcast can't determine which exercises or activity levels are appropriate for your knee, your health history, or your current abilities. Your surgeon or physical therapist can certainly help you make those decisions if you'd like help with them. Strength is one area that may still deserve attention. Quadriceps weakness can remain after walking looks fairly normal and may show up on stairs, curbs, lower chairs, or controlled lowering. Progressive resistance could include sit-to-stands, step-ups, controlled step-downs, leg press, knee extension, or other exercises selected and progressed for your needs and abilities. The name of the exercise is less useful than knowing whether it is appropriate for you and provides enough challenge to support change. Walking is useful, but walking and strengthening are not interchangeable. Walking can build endurance and general activity tolerance, yet it may not provide enough resistance by itself for more demanding tasks. If walking is part of your plan, consider whether the distance, pace, surface, and duration still match what you want to prepare for. Changes should be gradual and tolerable rather than based on proving how much you can do in one day. That might be fun, but usually the next day is not so fun. Your balance may deserve direct attention as well. Practice could begin near a stable support and might include a narrower stance, supported single-leg balance, stepping over small obstacles, changing direction, or walking on different surfaces. The challenge needs to match your current ability and safety needs. Always be safe with this. If you feel unsteady or have a history of falls, get individualized guidance instead of experimenting alone. It's always great to have someone there when you're working on your balance too. As those abilities improve, the way you perform a task can reveal whether your other leg is still taking over. You may shift away from your operated leg when you stand from a chair, pull heavily with your arms on stairs, or turn your body when stepping down. And those strategies can be useful early. If they continue, a physical therapist can help determine whether strength, motion, pain, balance, or habit, among other things, is driving the pattern and whether it's appropriate to change it. Connecting exercise to an activity you care about can help you choose what to train. Walking through the zoo with your grandchildren, standing long enough to cook a holiday meal, returning to work, gardening, traveling through an airport, playing 9 holes of golf or 18, or attending a concert all place different demands on your operated leg. The activity itself can point toward a need for more walking tolerance, stair strength, balance, or practice with a particular movement. Day-to-day symptoms can still vary with sleep, swelling, activity, stress, and fatigue. A difficult day doesn't erase the ability you've built so far. Sometimes that's hard for people to conceptualize. A difficult day does not erase the ability you've already built. The larger pattern is more useful. Tasks may require less effort. You may need less support, or you may stay active longer before fatigue changes the way you move. Those changes can be gradual, but they count. In fact, I would argue that they tend to count more. New or rapidly worsening symptoms deserve medical attention still. Contact your surgeon or another appropriate medical professional promptly for a sudden major decline, a new inability to bear weight, significant instability, or signs that might indicate infection like increasing redness or warmth, new drainage, persistent fever, and seek medical attention for new calf pain or a large unexplained increase in swelling. Seek emergency care for new shortness of breath or sudden chest pain. If a persistent limitation is not changing, despite a reasonable plan, an individualized evaluation can help identify what's driving it. Between months 4 and 12, the work often changes from doing exercises because you had surgery to building abilities that support the life you want to live. You can finish formal physical therapy while continuing to work on strength, balance, and endurance. In fact, ask your therapist for how to progress your program. 1 or 2 activities may still need focused attention, even when you're doing well overall. And that's not evidence that you're behind. It may simply show that basic daily function returned before your higher demand abilities did. And that's usually how it happens. The early phase gave you a foundation. What you build on it can be connected to your priorities, whether that means easier daily activities, a return to work, more family time, more travel, recreation, or something entirely different. It's really up to you. If the thought, I guess this is good as it's going to get, starts showing up, it may help to ask whether the specific ability you want has actually been trained. That distinction can point to a next step without assuming that every symptom can or should be fixed through more exercise. Your next step does not have to be dramatic, and it does not require hours of exercise every day. It rarely requires all of that. It may mean gradually asking a little more from your muscles, a little more balance exercise or endurance at a level your body can tolerate rather than waiting for the calendar to do the work. If you're already doing that, great job. Keep going. The work may look less dramatic than it did during the first few weeks, but it can still support the activities you want your operated leg to handle. For more practical guidance during this stage, join the Total Knee Success Insider newsletter. Each week, I share new podcast episodes, clear explanations, and additional resources to help you understand what you're experiencing after knee replacement. You can sign up through the link in today's show notes. And if walking still feels awkward or less natural than you expected, My book, Walking Like Yourself Again After Knee Replacement, may help. It explains why walking can continue to feel different after the early months and offers practical strategies you can discuss with your physical therapist or use when appropriate for you. You can find the book through the link in the show notes. In the next episode, we're going to talk about something that catches a lot of people a little off guard: having a bad day after you thought things were going well. We'll discuss why those days can happen, what they may mean, and when a change fits the usual ups and downs versus when it may deserve a closer look. Thanks for joining me. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.